Can moving your eyes treat trauma? So there's a treatment called eye movement desensitization reprocessing. The idea being distressing thoughts and trauma are in our brain. Essentially, they're jammed in our brain. They're stuck there and not completely processed. Those dang brain traffic jams. Reminders of the trauma or stressors can re-engage the emotional reactions because the trauma hasn't been fully processed through. With our minds constantly working to protect us from pain, similar patterns that remind us of other stressful or traumatic events can trigger those emotions and feelings of trauma. Now, in this form of therapy, EMDR, the clinician guides the person's eye movements in what's called bilateral stimulation, sometimes listening to alternating tones in the left and right ear while the person has headphones on, or being touched or feeling some sort of physical stimulus on the left side or right side of their body, kind of alternating between the two. With the clinician taking the person on small little visits towards the traumatic memory. So as these small doses of small reminders of that traumatic event or that stressful event is done in a safe, comforting, structured, and controlled way, with the overall goal of EMDR being to reduce the response to trauma, with the clinician hoping that over time, the emotional response to that traumatic event will become less impactful and less overwhelming, with the understanding that yes, this traumatic event happened and it's still part of your life, but your response, your emotional response to this traumatic event is not as overwhelming. So with that, I just wanted to quickly jump into EMDR. I hope that someone out there finds this video useful. Thank you so much for watching.